Welcome to our podcast. My name is Amy Blum, and I'm the Chief Operating Officer at the National Gaucher Foundation, an independent nonprofit dedicated to serving U.S. patients with Gaucher disease and their families. Through financial support, educational programming, patient services, and collaboration with medical professionals, the NGF empowers Gaucher patients to live a better today. Today's podcast focuses on the link between Gaucher disease and Parkinson's disease. I am thrilled to be able to introduce our special guest, Dr. Rory Alcalay. Dr. Alcalay is an assistant professor of neurology at Columbia University Medical Center. He obtained his medical degree from Tel Aviv University, Israel, his neurology training from Harvard University, residency program at Massachusetts General Hospital and Brigham and Women's Hospital, and his movement disorders training at Columbia University. He is a graduate of the patient-oriented research and earned master's in biostatistics from Columbia University. His research focuses on biomarkers and genetics in Parkinson's disease, and specifically on GBA and Parkinson's disease. His research is supported by the NIH, the Parkinson's Disease Foundation, the Michael J. Fox Foundation, and the SMART Foundation. Dr. Alcalay, welcome to our podcast, and thank you so very much for joining us today.
Thank you.
Dr. Alcalay, I think a great place for us to start would be to discuss some basic terminology that we might be using throughout our conversation, so that our listeners are able to follow and appreciate the full depth of the conversation. So the first item that I would actually ask you to discuss, or items, would be to define and explain proteins and how that relates to enzymes.
Sure, thank you. So proteins are large molecules that basically construct our body. They're very important. They're essential for our functioning, and they're divided crudely to a couple of groups. There are the proteins that are structural proteins that maintain the structure of each cell and of the entire body as a whole. And there are the other types of proteins that function as enzymes. And enzymes are basically large molecules that accelerate chemical reactions and are very important for key chemical reactions in our body.
Excellent. Thank you so much. And then when we talk about Gaucher disease, many of our listeners will recognize hearing that it is a lysosomal storage disorder. So let's just back up and perhaps explain what a lysosome is.
Sure. So a lysosome is essentially the recycling bin of the cell. So the cell keeps on building. There's different processes in the cell where molecules are being built and being degraded, and when they are degraded, the cells use the compounds again and again to rebuild those large molecules. So lysosomes are the recycling bin, where large molecules that need to be degraded, but the body no longer needs them or needs to recycle them, enter that part of the cell where different enzymes break down those large particles into small particles that can be used later by the cell.
Wonderful. Thank you so much. And I think that will help a lot as we continue our conversation. So let's define what we mean by Gaucher disease first, and talk about what Gaucher disease is, and then we'll move on to what Parkinson's disease is.
So Gaucher disease is a lysosomal storage disease. So it's a disease that affects the lysosome, where one of the key enzymes in the lysosomes that is in charge of breaking down lipids is not functioning, and that's the enzyme glucocerebrosidase. When glucocerebrosidase is not working as well as it's supposed to, those large molecules that need to be degraded in the recycling bin, the lysosome, are not being recycled, and as a result, they accumulate initially in the lysosome and then in the entire cell.
Okay, wonderful. Now, when we talk about Parkinson's disease, what are we talking about, and how would you describe Parkinson's?
Parkinson's disease is a completely different syndrome that is only recently has been associated with Gaucher disease. Parkinson's disease is a neurological disease that is a degenerative condition. So it means that the cells were once, the cells in the brain were once normal and functioning well, and then something happened, and those cells go through a process where they don't function as well as they did before until they're degraded and essentially die. Parkinson's disease initially, or at least in earlier stages of Parkinson's, affects a specific group of nerve cells, of neurons, and these are neurons that secrete the neurotransmitter that is called dopamine. And a lot of the symptoms that people identify with Parkinson's disease are related to the fact that there isn't a sufficient amount of dopamine in the brain. And as a result, people will develop slowness of movement, shuffling of gait, and a tremor, rest tremor, that is very commonly associated with Parkinson's disease.
Thank you. Now, I know that often we might hear about Parkinson's disease, but then we also hear of something called Lewy body dementia that is perhaps somehow or another related to Parkinson's disease. Could you explain what Lewy body dementia is, and if and what the relationship might be to Parkinson's disease?
Sure. So Parkinson's disease and Lewy body dementia are sister diseases, in the sense that if one dies and we look at the brain under the microscope, it's very hard to distinguish Parkinson's disease from Lewy body dementia, and it depends on the stage of the Parkinson's disease. So Parkinson's disease, as I mentioned before, is mostly identified by the motor symptoms of Parkinson's. But now that we treat the motor symptoms relatively better than before, a lot of non-motor symptoms have become a focus of a lot of research and attention in the world of Parkinson's. Of all the non-motor symptoms that are linked to Parkinson's, the one that is most debilitating and the one that affects people who are affected by Parkinson's lives the most is cognitive impairment. And some people with Parkinson's can have no cognitive impairment. Some people with Parkinson's can have mild cognitive impairment. And some people with Parkinson's, as the disease progresses, develop dementia. In parallel, there are people that never go through the phase of the motor symptoms of Parkinson's, or their motor symptoms of Parkinson's are relatively mild, and the presenting symptom of their neurological condition is the dementia. If that's the case, and the dementia appears early on, and it's a dementia with a type that appears with Parkinson's or Lewy body, we call it Lewy body dementia. It's sometimes hard to distinguish Lewy body dementia from Alzheimer's, but usually people with Lewy body dementia have a little bit of the Parkinson's symptoms of slowness of movement and shuffling of gait. They tend to have more hallucinations than patients with Alzheimer's disease, and they have better memory and better language, but harder time in multitasking, for example.
Wow, it's really quite fascinating that over time we're learning so much and being able to distinguish and classify different symptomology that's being seen in different manners. There's one more term that I'd like to ask you about, because I think it may come up at some point during our conversation, and it's more technical, and that would be if you could explain what an autophagic lysosomal dysfunction may be.
So autophagic lysosomal dysfunction is something that most probably happens in both Gaucher and Parkinson's disease, and may link the two conditions. So we know that in Gaucher disease there's a lysosomal dysfunction because one of the key enzymes in the lysosome isn't working and lipids may accumulate. But a lot of recent research has focused on understanding the link between Gaucher and Parkinson's. In Parkinson's disease, when we look at people who donated their brains for research who were affected by Parkinson's, we don't quite see accumulation of lipids, we see accumulation of proteins. And the thought is that this recycling bin that I was describing earlier, the lysosome, is dysfunctional for one reason or another, and that would lead to accumulation of proteins because the recycling bin is just not working. And theories that or research that focuses on the autophagic lysosomal pathway is trying to figure out why is this pathway affected in these two conditions and what can be done to fix it.
Okay, thank you so much. So you started to just kind of touch on that more recently we have research has shown that there's some connection between Gaucher disease and Parkinson's disease. But could you take me a little bit through the history of how that connection was realized?
The connection between Gaucher disease and Parkinson's disease was realized mostly by astute clinicians, and this is very different from other genes that are linked to Parkinson's. Most of the genes that are linked to Parkinson's have been identified through either looking at families where there's a lot of Parkinson's in the family tree, and by these large families, we could identify the gene that caused Parkinson's in that family, or by large studies that compared a lot of people with Parkinson's to a lot of people without Parkinson's and identified genes that are more common in people with Parkinson's compared to controls. The link between Gaucher disease and Parkinson's was identified by clinicians who noted initially higher prevalence of Parkinson's or Parkinson's-like symptoms in Gaucher patients, but then also higher prevalence of symptoms of Parkinson's in the parents of those Gaucher patients. And when you look back at the literature, we see that reports about people who were affected by both conditions were actually present 20, 30 years before a publication in the New England Journal of Medicine in 2004 really highlighted the potential link.
Wow. Dr. Alcalay, could you talk a little bit about what the current research is that's occurring for the connections between Gaucher and Parkinson's?
Absolutely. So I think this is one of the most exciting field of research in neurology in general, but actually in the entire field of medicine. So Gaucher research reached a point where people are treated quite well for the symptoms that are not in the brain with different types of medications. But the Gaucher symptoms in the brain that are more prevalent, of course, in Gaucher patients who are affected by Gaucher type 2 or type 3, these are not well addressed by current medications. Similarly, we don't quite know what causes Parkinson's disease, so we have quite good symptomatic treatments for Parkinson's, but there's not a single FDA-approved intervention to slow down or to prevent Parkinson's. So the identified link between Gaucher and Parkinson's disease may really benefit the scientific world and the people affected by Gaucher and by Parkinson's in both directions. So if we find an intervention that affects Gaucher disease that penetrates the brain, that may help Gaucher patients with brain symptoms. And if we find such an intervention, it may or may not, but we need to study it, it may or may not slow down Parkinson's disease or maybe even prevent it if administered early enough. So there's a lot of research going on trying to see whether we can intervene on the GBA, the Gaucher pathway in the brain, in a way that will be beneficial for both Gaucher patients and for Parkinson's patients, especially those who are affected by GBA mutations or Gaucher disease.
And do you have a sense of perhaps a rough estimate of how many different research studies may be occurring at this point in time, combining looking at these pathways and what might actually be effective on either end that could help us, on the flip side with one of the diseases or the other?
There are multiple studies going on worldwide. They're funded by the National Institute of Health, the NIH, the Parkinson's Disease Foundation, the Michael J. Fox Foundation, the foundations outside the United States, like the Wellcome Foundation and European foundations as well. So I think that this is exciting times because there is really a lot of effort. I don't think it can be counted. The pace of the research is faster than we anticipated, so we're not quite sure how are Parkinson's and Gaucher linked, but there are already at least 3 clinical trials worldwide trying to modify the Gaucher pathway in the brain in order to slow down or prevent Parkinson's disease. So the people affected by Gaucher and Parkinson's, the pharmaceuticals, they're not waiting for us to really uncover the entire biological pathway. People want cures and answers now.
Amazing. And maybe this kind of leads a little bit into this next topic, but some of us have heard of the term personalized medicine. Others may not be so familiar, so I'm going to ask you to explain briefly what personalized medicine is, and then we can kind of talk about how it intersects with this research that we're, that we're talking about for Gaucher disease and Parkinson's, and then how it might also reflect on health policy.
Absolutely. So the underlying hypothesis of a lot of research and a lot of treatments that we're using nowadays is that people respond similarly to medications. So if you have an infection, a strep throat infection, all people or most people will respond quite well to antibiotics. Personalized medicine is somewhat of a different approach, and that would be that instead of treating all people affected by the same condition or by similar conditions in the same way, that we need to tailor the treatment for the specific individual. And personalized medicine has gained a lot of success and exciting results in the field of cancer, where probably ages ago people used to say that they had cancer, and then they would just say cancer or breast cancer or the cancer of the specific organ. And now really the people who are affected by cancer and doctors who treat it would refer to the cancer based on the genetics of the cancer, based on markers in the membranes of the cells of the cancer. So the treatment is no longer the same for all people who are affected by the same condition, let's say breast cancer, but rather personalized. Similarly, we've acknowledged for a very long while that Parkinson's disease is not one condition, and it really is many conditions that look alike that affect the same or more or less the same areas of the brain. And one of the proofs for it is that there's more than 20 genes linked to Parkinson's, and many of them are associated with Parkinson's, but the Parkinson's can be a little bit different among different people with different genetic profiles. So the link between Gaucher and Parkinson's may be the first time that personalized medicine can be used in Parkinson's disease or other neurodegenerative conditions, where rather than treating everybody the same way, so if I mentioned that in Parkinson's there's reduction in the levels of dopamine, so by dopamine replacement therapy, rather than treating everybody with dopamine replacement therapy, we're saying, oh, some people have Gaucher mutations, let's treat them by enhancing the Gaucher pathway. Now, this has not reached FDA-approved interventions yet, but this approach has clearly reached the stage of clinical trials.
That is incredibly exciting.
Now, similarly in the Gaucher world, most people with Gaucher disease will never develop Parkinson's, but there is a substantial percent of people with Gaucher who will develop Parkinson's, roughly 10%. So identifying these people to see maybe they need more interventions that don't just treat Gaucher specifically, but rather treat the risk for Parkinson's, that will be personalized medicine for Gaucher when this stage arrives. We are working hard to get there.
And what impact might all of this personalized medicine have on health policy, and where I would imagine that there could be concern from the larger community? Well, what might that mean if it's personalized? How much of my information is going to be known? But conversely, how might we be looking at in the United States a shift in perhaps these treatments and thinking about personalized medicine, and what might the ripple effect be in terms of what health policy could look like?
I think these are great questions. I think that we're in the beginning of this research and we'll learn more as this uncovers. I think that it is absolutely clear that for precision medicine, one needs to analyze genetic data from people to see how to treat them, and genetic data is clearly perceived and is clearly more personal and of a concern of privacy constraints that are associated with it. And I think this is something that we need to integrate into the design of clinical trials and into the design of management of these conditions. For example, currently we do not clinically offer routinely Gaucher genotyping, GBA genotyping for people with Parkinson's, but if this would determine the treatment, because it would be type of personalized medicine, then of course we would need to do that, and that would raise a lot of questions about privacy and about who knows what and where would the information be stored. And I think this is a work in progress that we all need to think about together.
Amazing. And in all of this that we've been discussing, that you shared the enormity of research that's occurring now, and this evolvement, if you will, of personalized medicine really speaks to such an importance of the community really being engaged and continuing to keep abreast of what's going on. When we finish with the podcast and we actually publish it, we will also have information for links to some of these other foundations that we've talked about, be it the Parkinson's Disease Foundation, the Michael J. Fox Foundation, so that people can go to and look and see what research is occurring and see where there might be a call for recruitment of participants. And it speaks to the value of having the greater community invested in wanting to participate in these research studies to help us get to the next point of understanding the diseases. We have some really wonderful questions that we had received from our community members, and I'd like to take some of the remainder of our time together to ask you these questions, because I know that there are people that are very eager to have these questions answered. So you touched on this very briefly a little bit earlier on, but we do have a question about, is there also a connection to Alzheimer's from Parkinson's? And then what would be the if so, what would be the differentiating features between Alzheimer's and Parkinson's disease?
So Alzheimer's disease and Parkinson's disease are similar diseases in the sense that they both affect the brain, and they're both neurodegenerative, where cells in the brain decay over time. When one looks at the brains of people affected by Alzheimer's disease, the accumulation of proteins there is quite different from the ones in Parkinson's disease. It's mostly tau and amyloid, while in Parkinson's disease it's alpha-synuclein. When research was less advanced and less biologically driven, people with dementia that just didn't perform cognitively as well as they used to were called either demented or people with Alzheimer's disease. But now that we do a little bit more careful research, we can distinguish different types of cognitive changes. The typical presentation of Parkinson's disease is motor presentation and the non-motor symptoms, but not quite cognitive impairment and dementia. This can later on appear in Parkinson's disease 10, 20 years into the condition. The way to differentiate it between cognitive impairment associated with Parkinson's disease to cognitive impairment associated with Alzheimer's disease is the focus of much research. As I mentioned before, Parkinson's disease-related cognitive impairment is more associated with hallucinations, with difficulty in multitasking, sometimes with orientation in space. But people with Parkinson's disease that have cognitive impairment usually don't have the major impairment of language and of memory the way people with Alzheimer's would have.
Thank you. So we also, another very interesting question that we received was related to inflammation. Someone had asked us, what role does inflammation play in both Gaucher disease and Parkinson's disease?
This is a great question. It's the question about the role of inflammation in Gaucher disease and Parkinson's disease is the focus of much research. I don't want to talk much about Gaucher disease just because I'm not a Gaucher expert as much as an expert in Parkinson's or in the link between Gaucher and Parkinson's. Since Gaucher disease primarily affects macrophages, so it affects the immune system, this raised a lot of interest in the Parkinson's world to understand the role of macrophages in specifically, or the immune system in general, in Parkinson's disease. And it will have a great importance in understanding this for treatment because we know how to modulate the immune system. So the question is whether the experience we have of the link between Gaucher and Parkinson's would direct us towards the inflammation and to the immune system, and whether this would lead to new treatments for Parkinson's that would modulate the immune system as well. So to summarize my answer, I think that the role of inflammation in Parkinson's disease is not completely understood. It's focused of much research and a lot of interest in the field in figuring it out.
Okay, and then I'm going to jump to another question here that that we received. What is the role of glucose cerebrosidase mutations in Parkinson's disease? And again, I think you have touched on this previously in our conversation, but let's just address it specifically to this question.
So I can try to answer this question from what we know. So we know that glucocerebrosidase mutations are more common in people with Parkinson's than in people without Parkinson's. Most of the people with glucocerebrosidase with GBA mutations do not develop Parkinson's disease or similar conditions, but it's definitely an important risk factor and probably the most prevalent risk factor for Parkinson's disease that we can find when we genotype a large cohorts of people with Parkinson's. So 5 to 10% of the people with Parkinson's carry mutations in GBA. We assume, but we're not sure, that the cause of the link is because GBA mutations cause reduced of the enzyme glucocerebrosidase, that, as I mentioned, is a lysosomal enzyme that is in charge of breaking down lipids. So we assume that the fact that this enzyme is not working as well in people with mutations compared to people without mutations is maybe what leads to later on the development of Parkinson's disease, but we're not 100% sure. We haven't confirmed that this is really what causes it, and that maybe correcting these mutations may reduce the risk for Parkinson's or slow down the progression.
So, and this may be a question, the next question that I'm going to ask that was sent in, and again, we touched on this a little bit, and it may be asking you a little bit more for your opinion based on current knowledge base, but should all individuals who are diagnosed with Parkinson's disease be carrier screened for Gaucher?
Currently, we're not testing all patients with Parkinson's disease for Gaucher mutations, for GBA mutations. One would say that maybe we are not advanced enough as the science that we published ourselves. We know that people with Gaucher mutations have a little bit of a different type of Parkinson's. It's quite similar, and personally, on an individual level, when I see a patient with Parkinson's, I cannot guess who has Gaucher mutations, who has Gaucher disease. It's just based on actual lab testing that we can determine this. But people with Gaucher mutations tend to progress a little bit faster than people with Parkinson's disease without Gaucher mutations. I think that the motivation to offer testing for everybody would be when there's treatments that target this pathway, specifically in mutation carriers. And then everyone with Parkinson's, I assume, would want to know if they're carriers or not, because it will change the way the Parkinson's is managed. Having said that, in 2018, it sounds like a lot of patients and a lot of family members want to know what caused Parkinson's, why do people develop it, and they want to know if they're carriers or not. So giving them the opportunity to find out by offering them CLIA-approved testing for Gaucher mutations sounds very reasonable. It will also help people decide whether they want to participate in clinical trials or not. And this is something that we need to work on to make it more available for the larger Parkinson's community.
Okay. So, and this answer that you just provided helps to kind of lead into another question that we received from an individual community member who wants to know if that person is a carrier, a Gaucher carrier, and someone in that individual's family has Parkinson's disease, what does that individual need to know or think about or be concerned about for that individual personally, but as well for any children that that individual may have?
So let me start with the children because it's a little bit easier. The children are 50-50% chance of being carriers for the gene, so they may actually not be carriers. But even if they are carriers, I really hope that by the time the children reach the age where Parkinson's is the risk, so 40s, 50s, more likely 60s, I think that the way we treat Parkinson's will be completely different from the way we treat it now. With regards to people who are Gaucher carriers now and want to have Parkinson's in the family, I think that if there is a way to be engaged in research, that's an excellent way of trying to fight the condition yourselves because you're going to help research by doing that. But there aren't any interventions that we know that one can do to prevent Parkinson's or to slow down Parkinson's. So exercising and eating healthy is always better and probably prolongs life, but we don't know of such specific interventions that can reduce Parkinson's risk. There are some studies that show that pesticides are associated with Parkinson's disease, so avoiding pesticide exposure sounds reasonable, but there are no large validated studies that show how we can reduce Parkinson's risk in people who are carriers. That person also asked about Parkinson's in the family, and I think that the story of Parkinson's in the family is can make one feel more alarmed about Parkinson's disease. But when we did studies of families with Parkinson's disease, when one has Parkinson's, the risk for the offspring or for siblings is roughly 10%, which means that 90% of those who are first-degree family members of someone with Parkinson's will never develop Parkinson's. So it increases the risk a little bit, but it's not an overwhelming increment in Parkinson's risk.
Okay, so it's always just good to make sure that your physician is aware of your family history and can, you know, continuously monitor and make suggestions or recommendations that factor in your entire family history at any point in time, depending on what your health may be looking like. So I want to go back to, we had discussed a term of the autophagic lysosomal dysfunction and Gaucher disease, and is there a role, or what would be the role of this in both Gaucher and Parkinson's disease?
A lot of people are working on trying to manipulate the autophagic lysosomal dysfunction. A lot of people are working on the autophagic lysosomal pathway to try to modulate it in a way that will be helpful for people with either Gaucher or Parkinson's or both. So I think it's a focus, this pathway is a focus of a lot of research, and I think we'll hear a lot more about it in the coming few years.
So Dr. Alcalay, I'm sure many of our listeners would be eager to understand and to know more. If they have been diagnosed as having Gaucher, what is their risk for developing Parkinson's disease?
There were a couple of studies that tried to answer this question. One of the studies, and that's probably the largest study, used the Gaucher registry, and the that people who treat people with Gaucher disease enter data into the registry, and based on what they wrote there, we estimated the risk for Parkinson's at roughly the age 80 among Gaucher patients at 10%. So it means that by age 80, 10% of people with Gaucher disease type 1 would have developed Parkinson's disease. However, the registry was not designed to answer specifically the question of Parkinson's disease, so there is a chance that this estimation is either overestimating or underestimating. We're not sure. So additional studies need to be done, but the best estimate we have for now is 10% by age 80.
Okay, and another question that I think would be of great interest is, while it's clear that most Gaucher patients won't develop Parkinson's disease, what additional risk factors do exist?
So there are a couple of risk factors that we cannot modify, but are very well known to be associated with Parkinson's. One of them is being male, so men have a higher risk for Parkinson's compared to women. It's 2-to-1 ratio, and we see a similar ratio among the Gaucher patients. And the other risk factor that we cannot modify, but is a risk factor for Parkinson's, is age. The older one is, the higher the risk for Parkinson's. So Parkinson's is exceptionally rare in people in their 20s and 30s, and it's much more common in people in their 70s and 80s. In addition to those demographics of male gender and older age, we don't know a lot about what increases the risk for Parkinson's in the Gaucher population. It doesn't seem to correlate well with disease severity, which means it's not that if one's Gaucher is worse, the risk for Parkinson's is higher, because we see a lot of people that did not even know they have Gaucher disease, but when we screened our clinics, our Parkinson's clinics for Gaucher mutation, we discovered that they were not only Gaucher carriers, they actually have Gaucher disease. And the Gaucher disease was so mild that it was never recognized or treated. Also, we don't have sufficient data to say whether treatments for Gaucher disease itself would help reduce or eliminate the risk for Parkinson's. So from my personal experience, I can say that I've seen quite a few patients with Gaucher disease who've been treated with treatments for 20, 30 years, 20 years more accurate, and still develop Parkinson's disease, and some people who never were exposed to any Gaucher treatment and also developed Parkinson's disease. So as far as we can tell, the numbers are not large enough. Neither Gaucher severity nor Gaucher treatment with the current available treatment changes significantly the risk for Parkinson's disease, but we don't really know.
Wonderful. Well, that's all the time that we have for today. I want to thank you, Dr. Alcalay, for sharing so much of your insights and experience on this very important topic. We're very, very grateful for your time. Thank you to our listeners. If you want to learn more about Gaucher disease or the National Gaucher Foundation, please visit www.gaucherdisease.org. You can sign up for our monthly newsletter, read articles and blog posts about living with Gaucher disease, as well as patient stories and videos. You can also follow us on Facebook. Please check back for future podcasts from the National Gaucher Foundation. Thank you, and we hope that you'll join us again next time.